Hello, and thank you for viewing the Middle Range Theorist Project by Deb Sen-Gill and Kelly Edwards. I am Kelly Edwards, and I will be presenting the theory of transitions. Afaf Ibrahim Melis, a native of Egypt, began working on the theory of transitions in the 1960s while completing her master's and doctoral degrees at the University of California, Los Angeles. She began her work on role insufficiency theory with an interest in immigrant health. Role insufficiency was defined as any difficulty in the cognizance and/or performance of a role, or the sentiments and goals associated with the role behavior perceived by the self or significant others. Melis, 1975. Her work on transitions theory began with her interest in the nature and human experience of transitions. The development of transitions theory began with Melis's work on role insufficiency theory resulting from unhealthy transitions through her work on immigration. The goal of a healthy transition was mastery of that new role. Melis's early work in immigrant health and situational transitions, alongside many of her colleagues, led to the development of the transitions framework as a concept. Later, a literature review and the conceptual framework for transitions theory were developed through the mentorship of Chick, one of her doctoral students. Following this work, Ian OKM published another literature review on transitions theory to guide future theoretical development. Refer to Figure 1 for the following discussion. There are 4 types of transitions: developmental, situational, health, illness, and organizational. The transition pattern can occur individually but often coincides with more than one transition. The properties of transitions prove that transitions are complex occurrences. Awareness of the transition occurrence. Engaging in the transition. The level of one's awareness affects the level of engagement, because without awareness there is no engagement. Changes and differences in the individual result in the sense of the ability to move forward. Time span refers to the starting point of the transition leading to an eventual end of the transition. There are specific markers such as birth, death, or illness diagnosis that are critical for a person's transition. As far as transition conditions, there are facilitators and inhibitors of transition. Conditions that promote or hinder how someone moves through achieving a healthy transition. Personal conditions are the meaning that one attaches to a transition. Community and societal conditions can enhance or inhibit a successful transition as well. Process indicators could be feeling connected and successful in a new community. And outcome indicators include the mastery of new skills or behavior, indicating an individual's successful transition. Nursing therapeutics include readiness assessment, transition preparation, and role supplementation. Readiness assessment evaluates readiness during the transition. Preparation would include the education to set the individual up for a successful transition, and role supplementation. The following research article will discuss role supplementation in more detail on the next slide. Smeddy et al. 2021 surveyed nurse educators during an adoption of a new framework for an online nursing education program. Over half of the participants in this research were novice educators. This study identified the components that facilitated role transition and those that hindered it at the personal and organizational levels. Novice nurse educators are often unprepared in their teaching, social, and cognitive presence for the classroom. This article addresses role insufficiency with role supplementation at the personal and organizational level, resulting in role mastery for the novice educators. Role supplementation describes the actions or approaches that can be used to treat or avoid role insufficiency situations both before and during the transition. The role insufficiency circumstances are alleviated in nursing education using some instructional and social presence conditions. The collaboration, engagement, and motivation of the academics and the students in the classroom were enhanced because the students participated in developing the learning materials. This impacted in social presence by promoting the development of the learning community and fostering a sense of belonging. These 2 role supplementing elements will benefit the students' learning and aid academic nurses in their smooth transition.
Hello, my name is Deborah Sandgill, and I will be presenting the Synergy Model. History. In 1993, the conceptual framework was developed for the purposes of certification. And in 1994, the conceptual framework was proposed to the members at AAC and NTI. In 1995, comprehensive and systematic study of critical care nursing using the Synergy Model and refinement by subject matter experts happened. In 1996, optimal patient outcomes and quality indicators were identified, which includes patient and family satisfaction, rate of adverse incidents, complication rate, adherence to the discharge plan, mortality rate, and patient length of stay. In 1999, the framework was adopted as a CCRN exam framework, and in 2010, it was used as renewal synergy for CERP based on the nursing competencies of the AAC and Synergy model for patient care, and it was launched as a primary renewal program for CCRN and PCCN certified nurses. And now, the organizing framework for AAC and certification exam is the Synergy model. Development. As mentioned earlier, the AAC and Synergy model was developed in the 1990s for certification purposes. It modified the nursing skills assessment from the medical model to nursing competencies to align with current nursing practice. Over the years, this model has been utilized for different purposes such as education, quality improvement, patient care, and so on. These have also been utilized as guidelines and frameworks used for DNP projects and PhD dissertations. AACN's vision is that nurses' contribution is invaluable for best patient outcomes. In this framework, patient and nurse synergy is prioritized, not tasks that need to be done. This can also be useful to nurses as professional growth and development framework. It has also been used to develop nursing curricula. The Synergy Model. The Synergy Model delineates three levels of outcomes, those derived from the patient, those derived from the nurse, and those derived from the healthcare system as shown in this illustration here. In the Synergy Model, the needs and characteristics of patients or families affect the characteristics or competencies of the nurses. According to AACN, synergy results when the needs and characteristics of a patient, clinical unit, or system are matched with the nurse's competencies. The assumptions of the synergy model include patients are holistic in nature, therefore they must be considered holistically. Patient's family, they are instrumental in the relationship of the patient and the nurse. Nurses are multidimensional, and the goal of nursing is to restore wellness and or support the patient to have a peaceful death. Patient characteristics include resiliency, vulnerability, stability, complexity, resource availability, participation of care, participation in decision making, and predictability. Nurse competencies, on the other hand, include clinical judgment, advocacy and moral agency, caring practices, collaboration, systems thinking, response to diversity, facilitating of learning, and clinical inquiry or innovator or evaluator. Research. The Synergy Model in Practice, Applying the Synergy Model to Nursing Education by Roberta Kaplow. In this article, patients' characteristics was discussed as well as nurses' competencies and how they influence each other and the patient outcomes. Upon searching for research on the Synergy Model pertaining nursing education, this was the most relevant article I found. This is a case that demonstrates the role of a nurse educator. In this case, a new nurse received orientation, mentoring using Synergy Model. The patient then is assigned to this nurse in the ICU and is rapidly deteriorating. The nurse and the nurse educator collaborated in ensuring that the patient had the best possible outcome. In this example, both nurses' competencies led to the best possible outcome, which was a peaceful death in this patient's case. Based on my search results, I noticed that there was no research study on AACN's Synergy Model in nursing education. I believe that this can be a useful framework to develop nursing student skills or competencies evaluation tool. Theory of transitions and the Synergy Model, compare and contrast. So for comparison, they both have determined outcome indicators for patients. So the synergy model has patient and family satisfaction as an indicator, rate of adverse incidents, complication rates, adherence to the discharge plan, mortality rate, and patient length of stay. Meanwhile, the theory of transition has mastery and fluid integrative identities. Another comparison is that they both can be applied in nursing education as showed by the studies presented. And another one is that the research studies that were discussed pointed out the impact of collaboration on the outcomes, meaning it wasn't only the nurse and the patient that were involved, but also there were other factors and other contributing members in order to achieve those outcomes.
Transition conditions are comparable to patient characteristics, and they are intrinsic and extrinsic factors that contribute to successful outcomes in both models. Transitions theory and the synergy model gain momentum when the whole framework is in motion and working together.
For contrast, one is a theory and another one is a conceptual framework. So the theory is basically a set of logically connected suggestions stating the relations among several different paradigms and suggestions. So this is the transitions theory. On the other hand, the synergy model is basically a conceptual framework which explains why a given study should be done. So the conceptual framework will discuss what is known, it will identify gaps in our understanding of a phenomenon, and it defines the methodological foundations of the research, and that's according to Lara et al. 2020. One is created by theorists, a person, while the other one, the synergy model, is created or developed by an organization.
Transitions theory focuses on the transition process itself, while the synergy model emphasizes the nurse's competencies gained related to patient problems. With the transitions theory, the outcome equals a successful transition, while the synergy model's outcomes involve the patient, nurse, and the healthcare system as a whole.